Once seen as a disease of old age, bowel cancer is now increasingly affecting younger adults, with a 20% rise in cases of those under 50 since the 1990s. Here at the Countess of Chester Hospital, colorectal surgeon Dr. Vilma Chandra is part of groundbreaking research to understand why.
We do know that in young people the rate is increasing. This tends to be in the group that is over the age of 30, so 30, 40. It's probably in relation to smoking, with diet and with obesity. However, that said, we often see people who are young who don't have those other factors. And I think there absolutely is this assumption that that person's too young to have bowel cancer. And either the patient doesn't seek help or they seek help, they're told that it's probably hemorrhoids and nothing else. And the kind of symptoms that people will come up with, typically the ones you'd worry about, rectal bleeding, change in bowel habits. And typically it's not constipation, it's the opposite, it's people who get loose and diarrhea.
Someone who knows these symptoms all too well is mum of two, Therese Grace. She lost her youngest daughter, Millie, to bowel cancer at just 24.
I think she'd had symptoms from when she was about 17, 18, but she never told me for years. She never told anybody. She was mortified. She'd go to the doctors now and again, but wouldn't go through with the tests they asked her to do. One of the doctors said to her, well, one of the tests is a finger up your bum. So Millie's reaction to that was, F that. When we went to see the consultant and he sat us down and said, it's bowel cancer and unfortunately stage 4, he still said, but it's rare in young people. So it was never ever in the ether at all to consider bowel cancer for Millie or for, young adults. Millie's was in her liver and her ovaries already by the time she got her diagnosis. But if they'd have caught it when it was just in a colon, maybe she could have had an operation.
4 years on, Therese is determined to break the stigma around young people and bowel cancer. She's now the driving force behind a new campaign, Stop It Before It Starts.
I want young people to know the symptoms, be aware of the symptoms, know to ask for a fit test, dead easy, it's done in your privacy, your toilet, no one knows you're doing it. Be aware, Millie was 25, it can happen to you.
Trainee lawyer Bianca Perea was just 29 when she was diagnosed with stage 4 bowel cancer and told she'd only be offered palliative care.
Everything around treatment, I was just researching anything that I could do to help myself. So I did so many holistic things, oxygen therapy, red light therapy. There were times when I said, I've had enough. And I said to my dad, when do I get to say no? And he just said, you can't, you just have to keep fighting. So there were times when I remember I Googled Dignitas in Switzerland, probably broke my mum's heart. Oh God. Having discussions at times about I've had enough because obviously I'm her, I'm her youngest daughter.
Despite the bleak prognosis, Bianca defied the odds, responding well to targeted therapy, chemotherapy and surgery. She went on to become the first person in the UK to receive a liver transplant for advanced bowel cancer. Today, she's cancer-free.
I went down for my operation at 3:30 in the afternoon. It was 5 hours, Jenny, the lead surgeon. She's just fantastic. 5 hours to have a transplant is, yeah, that shocked me and I. But I remember I woke up and apparently the first question, my goodness, I'm crying a lot today. The first question I asked my hepatologist was, have we done it? Am I cancer-free? And he was like, yeah, you are. I know not everyone's going to have the same outcome, and I think that's what is that's heartbreaking. From the people that I've met, I think the people that push for themselves and advocate, that's when you get the best care. It's working with your doctors, and there are fantastic doctors out there that really kind of listen and take that on board, and that's when you get the best kind of treatment plan for you because you're working with them.